Greetings. Okay, my name is Kenneth Mututwa. I'm going to be presenting on the etiologies of Parkinson's and management in fourth year, Physiotherapy, Rubrics 2. So, definitions of Parkinson, starting with chronic progressive disorder primarily affecting the basal nuclei, which depletes the dopamine secretion. And we're going to find the cardinal features, which will be rigidity, bradykinesia, trauma, and postural instabilities. Okay. So on the etiology and classification, we're going to find on the primary Parkinson's, it will be idiopathic, 78% of it, okay, and non-cause or genetic predisposition, and also on the secondary Parkinson's, toxins, pesticides in the farmers, industrial workers, okay, manganese. So drug-induced can also cause this Parkinson's, like also neuroleptics or haloperidol, okay, and the antidepressants, and in some cases post-encephalitis, like encephalitis lethargica. Some people who have suffered encephalitis, okay, in the past might be likely to have this Parkinson's in the future. Parkinson's plus syndromes, side-dragger syndrome, progressive supranuclear palsy. Problem lists. Quickly, we are going to look on the motor symptoms and also the non-motor symptoms. Rigidity, bradykinesia, resting trauma, and postural instability. Those are motor symptoms. Non-motor symptoms, some of them, they are not written there on the screen, but I'm going to mention most of them. There will be dysphagia, okay, problem in the eating, swallowing problem, siluria, and also there will be vocal problem with speech problems, okay, and also excessive sweating, which is seborrhea also, and also GI dysfunction, GI problems, and constipations, urinary problems, sexual dysfunction, orthotic hypotension, edema of the feet, depression in most 70 to 75%, and also dementia in about 30% of most cases of patients. So now, on the management, short-term management, will try to increase their speed using the auto cues of metronomes and the active range of motions, trunk, hip, rigidity, we're going to reduce it via daily stretching and postural corrections and medication interventions. The medication which we usually use levodopa and the candidopa, then we, equals syndopa, we make syndopa. Those are powerful. The most drug used is levodopa, right? Then the long-term management will reduce the 4 risks, okay, maintain independence, okay, ADOs like dressing, feeding, okay, 6 minutes distance walk by 25%, get training, relaxation, balance and proprioception, strength and endurance. Okay, so cardiopulmonary respiration, cardiorespiratory, pulmonary, also endurance. Those are one of the things which we can work on. So physiotherapy interventions, movement amplification training, okay, of high effort limb trunk movement, cueing strategies, visual, using laser canes, floor marks, auditory metronomes, guided walking, balance and mobility, pedipation training, standing, step over step, turning drills, chair rising, repetitions, high grading. Okay, so adjustive management, like exercise prescription, aerobic strength, treadmill training, harness for safety, okay, distance band, focus, and on extensors, PNF diagnose for reciprocal patterns, education and home programs, energy conservation, activity pacing, home safety, remove lags, install grabbers, to increase the safety, and also daily 30 minutes exercise routine, hygiene. You can teach on the education program. Balance and proprioception using Franco's exercise, standing on an unstable surface, and also bilateral to unilateral standing, wide to narrow base of support, also open to closed eyes. Gait, obstacle gait, walking straight line, okay, walking sideways, walking backward and forward, relaxation, yoga, tai chi, Johnson's relaxation technique, meditations, You can also do on the postural mirror biofeedback, standing and walking on railings, and also standing in a straight line or tandem standing. So on the other thing, how you can able to reduce the edema. You can use a compression bandage, and also you can elevate the foot, and you can also use icing. Yeah. Otherwise, you can use also maybe the hot packs in those cases of chronic, you know, cases. Yeah. Otherwise, I hope you enjoyed. See you again in the next video.